Hi everyone, I just got done with an in-person birthing class that I teach, and in this class I teach so many things about childbirth, and one thing that a lot of the parents were not familiar with or never even heard of is an internal monitor to get the baby's heart rate. So this is called a fetal scalp electrode, and I'll show you guys what it looks like and how it's inserted onto the baby. So we always try to do external monitoring, but sometimes we need to do internal monitoring to get a more accurate reading on baby's heart rate, especially if it's really hard to trace the baby's heart rate, and especially if we're very concerned with what we're hearing as well. So this right here actually screws on, some people might say hooks, onto the baby's head, and the nurse or your provider can insert it. So it's actually in this thing, which I'm gonna, and of course this is like all sterile, you know, I'm not using gloves right now because it's educational purposes. So like I said, to insert this, the nurse or provider will have sterile gloves on. We use lubrication, and what we do is we take it like this and we guide it into the vagina and we feel the baby's head. We wanna make sure that this is not screwed on to a baby's soft spot. So it's all about feel. If someone is going to have this done, their water already has to be broken, or if a provider deems that the risks or the benefits outweigh the risks and wants to break the patient's water to get a more accurate reading of the baby's heart rate, they can do that as well. Nurses cannot do that. Nurse midwives can. So just for visual effect, so this is a baby inside of mom. Mom has to be dilated, like I said, and her water has to be broken already. So we do it by feel, make sure that we're not hitting the fontanelles. And then once we find a good spot, then we will twist this and it will screw in, or like people might say hooked into the baby's head. And since I can't actually hook it into this doll's head, again, visual purposes, it stays in there, and then we get rid of this part. Okay, and now it's connected to your baby's head. And then we attach this to the monitor. Oftentimes there's also another part where it is strapped to the leg, which is required for the machine to read it. And then we get a really good accurate reading on your baby's heart rate. Again, this is for more critical situations where we really need the accuracy of your baby's heart rate, we're concerned, or we really just cannot get the baby's heart rate. Hope you learned something.